You're dealing with some pelvic girdle pain while you're pregnant. It may be your posture. So pelvic girdle pain is the pain around the pelvis. It can be in the groin, it can be in the pubic bone, it could be in the back of the pelvis where the sacroiliac joints are, or even where the sacrum and the lumbar spine meet. That's all pelvic girdle pain that is pretty common in pregnancy. So there's two big postures that I see that contribute to this pelvic girdle pain. And in pregnancy, I see one called sway back. And that's where we have a lot of arch in the lumbar spine. And you can see how with Adrienne, her pelvis gets thrusted forward. And to counterbalance that, her shoulders come backward. So she has a large arch of her lumbar spine with her shoulders backward. The other type of posture that I see quite often is a tucked under bottom. So she tucks her bottom underneath, and then she really has to sling her thorax posteriorly. These are two really common postures that affect the pelvic girdle. So we can see in this posterior tucked position with the shoulders slung back, if she were to walk around like this, you can see how her pelvis is jutting forward and it's leading beyond her shoulders. And that's a problem. It puts a lot of stress through the pelvis. Same thing with the sling back or the sway back position. Sway back, we have a lot of arch through here. And again, if we have her walk with her sway back position, it puts a lot of pressure through her pelvis. You can see her pelvis is leading. So one thing I work a lot with my pregnant clients on is trying to educate about the proper positioning and how to think about their walking and standing during pregnancy. So we would try to go towards the neutral posture. So that means with her pelvis, we want her pelvis not really arched, not really tucked, but in the middle. And we want her thorax, which can ring like a bell, not rung up, not rung down, but rung in the middle, where her thorax is almost shining down into her pelvis. And that's neutral posture. Then for walking, we think about now letting your thorax and your chest lead the movement. That helps you move forward in your ankles, kind of like you're skiing. And that's a much better position, a much healthier position for her pelvic structures, her back structures, with walking and moving. So one of my favorite tools in helping with those two postures is this little trigger point ball here. It's made of foam and it's got some good density to it. So it's a really nice mobilization tool. So if you're early in your pregnancy, you can do the two stretches I'm about to show you laying on the ground. But later on in the pregnancy, that'd be a little bit tricky to do laying on the ground. I'll show you a variation. So when you have the sway back or the posterior tucked bottom with the posterior slung thorax, your deep hip rotators tend to be too active and over gripping, and they can become really tight. So I love using this ball in those deep hip rotators. So what you can do is you can lay down on the ground, and you want a pretty solid surface, not as good on the bed because it's a little squishy. You're going to put this underneath your hip, okay, right in the meat of the glute. And deep to those structures are your rotators of your hip. And if you just let the ball kind of sink in there, you're getting a nice stretch into those tissues, and they can be pretty tender. When you find a tender spot, you can roll around on that ball and sink a little bit deeper. And you do this on both sides. You can also use this in the mid part of your back. That's where you have a lot of changes during pregnancy, is in the mid thorax. And that can, those muscles can also be gripping and tight and angry. And you would do one side at a time on either side of your spine. The more that you let yourself melt into it, the more aggressive it is. The more that you keep yourself lifted up away from the ball, the less aggressive it is. So again, this would be best earlier in the pregnancy when you can lay down comfortably. So later on during the pregnancy, when getting on and off the ground is a little bit more challenging, or even laying flat on your back doesn't feel good, we can do this against the wall. So Adrienne has the ball here. We're going to put this underneath her glute muscles here. And she can just shift her weight back towards the wall and push into the ball and really get a lot of the same effect. Okay, so once you find a tender spot, Adrian, if you can just kind of picture that muscle melting, connecting your brain to your muscle can be really, really helpful. And take a few deep breaths to try to help soften the muscles down in the deep hip rotators. And then we can move this up to the mid-thorax, kind of the bra line or a little below. And we'll do one side at a time here. Let that ball just kind of gently push into those tender and tight muscles and visualize softness happening and a release of the muscle as you breathe into that ball. And it feels pretty good. A maternity support belt can also be really helpful in reducing the stress to the pelvic girdle during pregnancy. So this maternity support belt is called the mother-to-be support belt. This is something that your physical therapist can help you with to figure out which support belt is best for you. So if you want to turn to your side, actually, Adrian, I think we can see. So this support belt actually comes around the front, and it has these Velcro sections that we can pull up and around. And the force of this is lifting the fetus up and in. So it's basically just kind of giving a little hug to the abdominal wall and giving some support, taking some of the pressure off of the pelvic muscles. And we can see a lot of times the posture improve while using one of these belts.
Cool.
So in order to improve her posture even further, we can build some stability in the proximal hamstring, her core, and her scapular stabilizers. So this exercise gets a little bit of everything. So I'm going to have you stand in a split stance there, Adrian. Toes facing forward, heels facing forward. Now you're going to hinge at your hip and keep your chest forward. In this position, think about scissoring your legs together, but the floor won't let you move. So you're drawing the left leg back and trying to drive the right leg forward. Those muscles, or that activation, will help you kick in your proximal hamstring on that left side especially. Now holding this chest forward position, roll your elbows behind you as you squeeze your shoulder blades and exhale. Inhale, return. Using the muscles of our scapula here, inhale, return. And the resistance band is pretty light here. If there's any reason that your physician does not want you to be using resistance in pregnancy, please listen to your physician. But if you've been doing some exercises and some resistance work already, this could easily be incorporated in your program. So thanks for listening, and I hope you learned something about the two most common postures that I see in pregnant clients and how changing that posture with a few exercises and also just being cognizant of your posture can really help you reduce pelvic girdle pain.